Osteochondral lesions of the talus is a condition of damaged cartilage and bone on the bottom of the ankle joint, often caused by a severe ankle sprain. This condition can lead to painful flare-ups during activities like running or jumping. Dr. Andrew Litchfield is board certified in reconstructive rear foot and ankle surgery as well as foot surgery. Dr. Litchfield sat down to give us more information about how this condition occurs and how to treat it.
An osteochondral lesion is essentially referring to localized damage of the cartilage and underlying bone in a joint. In the ankle, it most commonly involves a bone called the talus, which is one of the major components of the ankle joint. These lesions can be thought of as an early, localized arthritis. The most common cause of this problem is an injury such as an ankle sprain or an ankle fracture. Presentation is usually delayed as damage may not be apparent initially after the injury. Often a patient will present with a nagging ankle pain years after a sprain or fracture. Because they occur after all types of ankle injuries, almost everyone is at risk for developing an osteochondral lesion of the talus. But they are more prevalent in the active population or those more prone to ankle injuries. The initial workup and evaluation involves a clinical exam, x-rays, and often an MRI. Once the diagnosis is made, the treatment depends on the patient's symptoms and, most importantly, the size of the lesion. The good news is that if they are caught early and are relatively still small, treatment options are less invasive and yield to good to excellent results in over 85% of the cases. Early treatment includes immobilization, rest, and partial or non-weight bearing. If conservative treatment fails, then surgery consisting of a minimally invasive arthroscopic approach to repair the bone and cartilage damage is performed. If the cartilage damage is too severe, however, treatment options are more limited and often involve a more invasive open surgery. A quicker recovery, therefore, also depends on early recognition and treatment. Recovery is faster in smaller lesions and after an arthroscopic procedure versus an open procedure for larger lesions.
Don't let foot pain keep you from living your life to the fullest. Dr. Andrew Litchfield and his expert team will get you back on your feet and doing the things you love.